Hello guys, today I'm going to discuss antithyroid drugs. A quick revision. Antithyroid drugs are basically used in hyperthyroidism, like Graves' disease, which is an immune disorder in which antibodies are produced against the TSH receptors. So these antibodies they stimulate the thyroid gland to produce T3, T4 and thyroid gland becomes enlarged. So these hormones they circulate excessive concentrations in the circulation, and they can produce anxiety, tremors, goiter, bulging of the eyes, which is known as exophthalmos, fatigue, thick and red skin. There may be excessive sweating also, and rapid or irregular heartbeat. So in this, thyroid gland becomes enlarged. So our goal is to lower down the T3, T4 in the circulation. So here you can see this is a thyroid follicle cells, and iodide is circulating in the circulation, and this cell will take iodide. This process is known as iodide trapping, and this iodide in the presence of hydrogen peroxide and enzyme thyroid peroxidase TPO will be converted to hypoiodate ion. So this hypoiodate ion it will bind to the tyrosine residues to form monoiodotyrosine and diiodotyrosine. So these two molecules of monoiodotyrosine and diiodotyrosine they combine to form T3, and two DIT or diiodotyrosine molecules they combine to form T4. This is known as coupling reaction, and they are stored in thyroglobulin. And when proteolysis occurs, these T3 T4 release occurs in the circulation. Now, how we can inhibit the synthesis of thyroid hormones by giving thioamides. So this is a group of drugs in which there is propyl thiouracil, methimazole, carbimazole. So these drugs they inhibit thyroid peroxidase enzyme, and they inhibit the conversion of iodide to hypoiodate. They have one more action. They inhibit coupling reaction also. So they inhibit formation of T3, T4, which is resulting because of coupling reaction. Now iodides also they inhibit the binding of hypoiodate ion to tyrosine residues. Another important action of iodides is they inhibit the release of the T3, T4 from these cells. So this is also known as thyroid constipation. Another thing is T3, T4 in peripheral circulation or peripheral tissue, they get convert T4 is converted to T3. So T3, I must tell you, T3 is more potent than T4, and it is responsible of majority of the actions in the body, which are because of thyroid hormones. And this conversion is inhibited by iodinated contrast media, beta blockers. Only propranolol can inhibit this. Dexamethasone is a corticosteroid which can inhibit this. Amiodarone is a drug which has 37% iodine content by weight. It can also inhibit this. Propyl thiouracil, this is thiamide drug, which is the only drug in the thiamide which can inhibit this conversion. Now if you come to the ADRs of thiamides, they can produce hypothyroidism if they are used for long term and monitoring is not done. Hypersensitivity reactions like rashes, urticaria, granulocytopenia, which is reversible. These reactions can occur. Another group of drugs is which is not used now is ionic inhibitors. In this, thiocyanate is there, perchlorate is there. They are because of their toxicity not used now. Another group of drug is radioactive iodine. Among radioactive iodine, iodine 131 isotope is used more commonly, and it gets concentrated in gland in place of normal iodide, and it destroys the gland from within, like it gets trapped, iodide gets trapped inside in the T3 T4 have now radioactive iodine, and from the inside it damages the gland up to 3 to 5 millimeter. In some patients, even single dose of iodide can make a patient euthyroid. The only drawback is it is used above the age of 40 to 45 years, and it cannot be used in pregnant because of it is teratogenic. Now some important points in this chapter are like propyl thiouracil is used in pregnancy. This is a drug of choice in pregnancy as it is mostly protein bound and does not cross placenta. And another important thing is propranolol is used till antithyroid drugs they take the effect. So before antithyroid drugs they take effect, which may take 2 to 4 weeks. Before that, propranolol is used to control the symptoms of like tachycardia, palpitations, tremor, sweating. So which are these symptoms are very troublesome. So propranolol is used for these controlling these symptoms. Next is in hyperthyroidism, surgery is required when there is compression symptoms because of the enlarged gland, or it may be required because of the cosmetic reasons. Another important point is uptake of iodine in cancer cells is rapid. Another important point is Lugol's iodine, which is 5% iodide in 10% potassium iodide. It is used 7 to 10 days before surgery to make the gland shrink in size, to make it less vascular and firm so that the blood loss is less and surgery is easy. Next important point is radioactive iodine 131 is most commonly used and it has half-life of 8 days. It emits gamma and beta particles within the gland. It penetrates 2 to 5 mm from within to outside. Another important point is some drugs they can cause hypothyroidism. You must know antithyroid drugs, amiodarone, anti-epileptic drugs like phenytoin, carbamazepine, phenobarbital, they can cause enzyme induction and increased metabolism of T3 and T4, so they can cause hypothyroidism. Salicylates, they can displace the thyroid hormones from protein binding sites. Uh, Tincture iodine, it can cause hypothyroidism. Iodide in cough syrups also, if they are used for long term, can cause hypothyroidism. Next important is treatment of thyrotoxicosis crisis or thyroid storm. So this is a medical emergency. Mortality is very high in this. So prevention is best. Supportive treatment is to be given, like there is hyperpyrexia because of the excessive hormones in the circulation. So treat hyperpyrexia with paracetamol, IV fluids, glucose. Propyl thiouracil is used as antithyroid drug in dose is 200 milligram 4 hourly. Iodides, they are the fastest acting drugs. So keep in mind, iodides they can inhibit or bring down the thyroid hormone levels quickly within 24 hours because they inhibit the release. But they are given after thioamides. So these drugs are not given before thioamides because the thioamides they inhibit thyroid synthesis, and uh, iodide is required for thyroid hormone synthesis. So if you give before iodide before thiamides, so it can decrease their action. So iodide is given after thiamides. It is given as sodium iodide 1 gram IV infusion, then propranolol for symptomatic relief intravenous 2 to 10 milligram every 4 hours. Dexamethasone is given 0.5 to 1 milligram intramuscular. Both of these drugs, propranolol and dexamethasone, you know they can inhibit peripheral conversion of T4 to T3. And or hydrocortisone can also be used 100 milligram 8 hourly. So this was all about antithyroid drugs. My aim is to make you revise the chapter quickly. When you get tired, you can listen and you can revise. Thank you. Please like and subscribe.